Hi there. As we discussed, I'm sending you home today with a prescription for Clopidogrel. It is known either as Clopidogrel, which is the generic name, or Plavix, which is the brand name. Today, I wanted to provide you with some general information on that medication. Clopidogrel is an antiplatelet agent, or a platelet inhibitor, which helps to prevent heart attacks, which is lack of blood flow through the heart, or it helps to prevent strokes as well, which is lack of blood flow to the brain in people at high risk for those conditions. Platelets are blood cells which clump together to thicken the blood or form large blood clots to stop bleeding when there is an injury. This medication reduces the clumping together of those platelets, those blood cells that join together to go to the source of active bleeding and stop that bleeding. In doing this, it helps to prevent blood clots from forming. Since you have just had a massive heart attack, we want to use clopidogrel in combination with aspirin daily to keep your blood thin and without clots. In order to prevent future heart attacks, we're going to prescribe 75 milligrams of clopidogrel to be taken 1 time a day. The medication is rapidly and well absorbed. When this medication is taken in a high dose, it can sometimes affect the time it takes to start working in your body. Your daily dose, 75 milligrams, can take up to 2 days to be fully effective. In order to be metabolized or broken down by the body, it must be transformed in the liver, then distributed throughout the body in the bloodstream. Clopidogrel is eliminated by the body after approximately 7 to 10 days when the platelet lifespan is over. Potential adverse reactions are numerous for this medication and can include things such as massive blood loss, since the clotting factor is inhibited, liver inflammation or liver failure, trouble breathing, confusion, headache, gastric ulcer, and pancreatitis, to name a few. It's very important to inform me or the office if you're having any issues when you start taking this medication so that we can decide together whether continuing on the medication is beneficial for you. Dosing for this medication can actually vary based on many factors, in children and the elderly, or those who metabolize medication slower may receive the medication at a dose individualized for their needs. So don't be surprised if you hear of someone else on this medication who is not taking the same dose as you. It's a very individualized dose. If you have any questions, concerns, side effects, or anything, please contact us and have those questions addressed. I'm happy to address those in our visit today if you have any today. But again, if you think of any later after you leave, it's important that you call and get your questions answered or to report side effects. Have a great day. I'll see you at your next visit.